Good afternoon, everybody. Thank you for coming to the Dean's Lecture. And I have to say, this is the first Dean's Lecture I've ever been to where there's a pile of cigarette packs on the table. So it gives some hint to what we're going to talk about. So we're here to celebrate Joanna Cohen's promotion to the rank of professor, and we're really happy that you brought your family, and your mom traveled all the way from Montreal to be here, so it's really nice. You know, to be appointed to our faculty is not easy. A lot of people compete for positions and don't get them, and so it's special. But to be promoted to the rank of professor is really a high honor, and it's a decision that's not made by us. We do the processing of the paperwork, but it's really made by decisions made by people all over the world. We write to peers and ask for their opinions of candidates, and so it's really your colleagues and peers who make the decision that you should be a professor at Johns Hopkins. So it's time to sort of stop a little bit and smell the roses and bask in the quite an accomplishment. So we're here to celebrate that. And now, when Joanna came, there was a lot of thought that we recruited her because she was Canadian, because Ron Daniels had come from Canada. We had a Canadian president. People thought I was trying to curry favor. David Holgrave and I were trying to schmooze the boss, but that wasn't the case, because in fact Joanna was born in Boston. Okay, right? So she is actually an American and a Canadian, right? So we were able to check both boxes with recruiter. And she went to McGill undergrad and got a degree in physiology and a master's of health science in community health and epi from the University of Toronto, and eventually realized that academia was her calling, and she went to UNC Chapel Hill and got a PhD in health policy. And that's where she started working in tobacco control and tobacco control policy. She's had a long association with Robert Wood Johnson, working and being sponsored by them, and then eventually came back to Toronto, went to Toronto as Director of Research and Training at the Ontario Tobacco Research Unit, which is at the University of Toronto, and it's funded by the government. And that's where we were able to recruit her and have her come here to head our Institute for Global Tobacco Control, and then take over responsibility for the Bloomberg Philanthropies project that we have on tobacco control. She came, it was in 2013 probably that we were in this room. She came in 2012 as the first Bloomberg professor in disease prevention, and we had a really nice ceremony, and Mike Bloomberg was here, as you recall, and it was a great day. She, as you all know, one of the ironic things for some of you, this is perhaps your first Dean's Lecture, is that what I do is I introduce the candidate who you know far better than I do, but I'm going to go ahead and do it anyway. So she works on factors that affect the adoption and implementation of public health policies, and also on evaluating the beneficial effects and the unforeseen consequences of those policies. She also works at the individual level at looking at factors that in smokers that encourage people to unfortunately adopt smoking or to quit smoking. She's done a number of studies, both in cohort studies and policy studies, and I'm sure you're going to tell us a little bit about them. And she is our strongest link with the Bloomberg Philanthropies here at the school. And as you know, the Mayor Bloomberg has taken this on as a cause to prevent some of the 1 billion deaths that are going to occur by the end of this century due to tobacco control. She's recently she's helped me a lot since you've been here. She was a force behind our campus, and then this entire campus going tobacco free, and then has been helpful to us in other aspects of wellness as we try to promote wellness. She recently worked with Henry Waxman to do the Centennial Policy Scholar Seminar Series, and Henry Waxman is a former congressman who was instrumental in the U.S. in having the FDA get authority to regulate tobacco. She was on the U.S. Food and Drug Administration's Tobacco Science Advisory Committee as a voting member for 2 years from 2013 to 2015. And she's mentored many students and colleagues, and she was, I think her first doctoral student was my stepdaughter. So I heard a lot about what an effective mentor and teacher you are. So please, we're going to hear about mosquitoes. Right, okay, so please join me in welcoming and congratulating Joanna Cohen.
That's great. Oh, this will work. All right, so thanks very much for that lovely introduction, Mike. And it really is a true honor to be able to give one of your Dean's lectures. So I'm going to start with the title of my talk. Some of you probably have already heard the quote that contains "Mosquitoes have no lobbyists," but for those who haven't, I'm going to explain where it comes from. So in the year 2000, the World Health Organization published a report that documented ways in which tobacco companies worked to undermine tobacco control activities at the World Health Organization. And in the report, the authors wanted to highlight the unique challenges that exist when trying to address tobacco use because of what tobacco companies do to fight with every tooth and nail. So the report's authors concluded that tobacco use is unlike other threats to global health. Infectious diseases do not employ multinational public relations firms. There are no front groups to promote the spread of cholera, and mosquitoes have no lobbyists. And what they're saying is that it's challenging enough for public health to deal with things like malaria, cholera, Ebola, Zika, for example. But our job is even more challenging when the public health threat we're trying to address is being fueled by a wealthy multinational industry that is aggressively fighting all efforts to protect health. So the report's authors go on to conclude that the evidence presented here suggests that reversing tobacco's burden on global health will not only be about understanding addiction and curing disease, but just as importantly, about overcoming a determined and powerful industry. So what I want to do in this talk is really focus on work that I've been involved in to understand how tobacco companies have undermined public health efforts to reduce the appeal and how misleading the cigarette pack is. But first, I'm going to just give you a brief description of what's going on around the world in terms of tobacco use and tobacco control efforts. So this graph shows global cigarette consumption from the year 1880 to 2009. And over the 20th century, global cigarette consumption increased by more than 100-fold. In 2009, over 5.8 trillion cigarettes were consumed. Over half of the world's smokers live in just 5 countries: China, Russia, the United States, Indonesia, and Japan. And indeed, China, which is represented by the darkest part of the circle, overshadows the rest of the world, consuming more cigarettes than the next top 29 cigarette-consuming countries. This map shows male smoking prevalence in the year 2013, and the darker the color, the higher the smoking prevalence. So smoking prevalence is highest in Russia and in Indonesia, with more than 50% of males smoking. And thankfully, male smoking prevalence is now under 20% in North America, good portion of South America, and much of Africa. Now, this map shows smoking prevalence among women in the year 2013, and the first thing that you see is the color of the map is much lighter than the color of the map of male smoking prevalence. So female smoking prevalence is highest in Europe, and actually very low in most of Africa, in the Eastern Mediterranean region, Southeast Asian region, and in the Western Pacific region. And this map shows the proportion of male deaths due to smoking. And the color distribution is similar to that for male smoking prevalence. Generally, the trends for smoking prevalence are followed about 30 years later by trends in tobacco-caused deaths. So in Russia, Turkey, and parts of Eastern Europe, over 25% of all deaths are due to smoking. And unfortunately, we're going to see China over here getting darker over time. In terms of numbers, more than 2/3 of tobacco deaths occur in low and middle income countries. So tobacco products are deadly, and the numbers are staggering. They kill up to half of people who use them. Tobacco products killed 100 million people in the 20th century. It's the world's single largest cause of preventable death worldwide. About 6 million tobacco-caused deaths occurred in the year 2011, and if current trends continue, we're expecting 8 million deaths each and every year from tobacco by the year 2030. And by the end of the century, tobacco may kill 1 billion people unless urgent action is taken. And it's critical to keep in mind that every death from tobacco is entirely preventable. So what's a big part of the problem? Well, here you go. It's the tobacco industry. We need to understand what's fueling the tremendous harms. And many of you are likely familiar with the epidemiologic model of infectious disease transmission. But for those who aren't, let me just walk through it quickly. So this model actually was developed to help identify the factors that are important in disease transmission so we can work hard to prevent it. So if we think of malaria, for example, the agent is the malaria parasite. The disease vector is the mosquito that carries the parasite. The host is the person who's at risk of being bit by the mosquito. And the environment are the conditions that help mosquitoes reproduce, for example. And so if we apply this to tobacco, the agent is the cigarette, the host is the person at risk of smoking, and the tobacco companies are the disease vector that are responsible for facilitating and encouraging the spread of smoking. This map shows a global cigarette market share, and I'll say that 5 companies represent 80% of the global cigarette market. The largest in this one color is the China Tobacco Monopoly Company, so they sell more than 1/3 of all cigarettes sold in the world. Philip Morris International, which is known as Altria in the United States, in this sort of light, sort of yellow color, is the market share leader in the United States and in most of Europe. In green, that's representing British American Tobacco, so they're the market share leader in Canada and parts of South America, southern part of Africa, and in Australia. And Japan Tobacco International is the market share leader in Russia and in the United Kingdom. So you may think that since tobacco companies have been called to task for their bad acts, that they have clamped down on efforts to market to young people. But unfortunately, that's not the case. So for example, Philip Morris International has a global marketing campaign for their Marlboro cigarettes with the tagline, "Don't be a maybe, be a Marlboro." The Institute for Global Tobacco Control has partnered with the Campaign for Tobacco-Free Kids to produce information videos about the Be Marlboro campaign. I'm going to try and show you one of those videos. The first part shows some of the footage from actual Be Marlboro videos and the marketing campaign. And then the part that we did, you'll see teens in the Philippines talk about the ads and about smoking. So let's try and do this. Here we go. Okay. Here we go.
Mixed emotions kasi all hail po dun sa nakaisip ng idea na yun sa Marlboro na hindi po naisip ng mga mas batang mga products.
Nakakaloko, grabe ah. Ginamit pa niya na yung maybe never trust, maybe never fall in love, yung mga ganon. Excuse me, magkaiba yung pangarap sa paninigarilyo.
Isipin ng mga iba, ad lang yan, bakit ginagawa niyang big deal? Pero sa totoo, yung konting push ng ad na yan, pwedeng makasilan ng buhay kasi once na naging smoker ka na, ang daming pwedeng sakit, ng cancer, pwedeng mamatay.
Tinigilan ko po yun, 2 taon. Tapos yun, dalawa na naman po. Parang hinarap pa rin ng katawan ko.
So po ang nangyayari, ang naging out sa mga, sa teenager na lang na tulad ko po, is, pwede na pala akong nanigarilyo.
Ako po, nagsisisi kasi ako kasi hindi ko na matigilan kahit gusto kong tigilan, hindi ko matigil-tigilan.
Siyempre yung mga dreams, aspirations namin, magpa-pursue kami doon. Pero yung paninigarilyo, huwag mo na idaan doon. Like, di niya lang sabi, manigarilyo ka. Idaan ka sa ganon.
To the point na lang dapat yun.
Ang ginawa niya kaming mga tama siya, mababaw. Nakakaloko talaga. Ginawa kaming mga hindi makakaintindi.
Baka by the time ko, after 1 decade, marami na palang nag-smoke ng dahil dun sa anime.
Okay. So that's just trying to get the word out about the Be Marlboro campaign. So I've described a little bit of the problem, and what are some of the things that are being done about it? Let's go. Okay, so one is the World Health Organization's Framework Convention on Tobacco Control. This is the world's first public health treaty. Now, other global treaties are things like the Framework Convention on Climate Change and the Kyoto Protocol or the Landmines Treaty. The FCTC came into force in 2005, and it's really a roadmap for helping countries commit to implementing effective tobacco control policies. Things like protecting people from secondhand smoke, helping people quit smoking, warning people about the dangers of tobacco products, restricting tobacco advertising, promotion, and sponsorship, and raising prices of cigarettes through taxes, among other interventions. So again, this is a world map, and the lighter blue color that you see covering most of the map are the countries that have signed and ratified the Framework Convention on Tobacco Control. A couple of noteworthy countries that have not yet ratified the convention are the United States, here we go, Argentina, and Indonesia is another big one. So let me summarize. It's important to keep in mind that the tobacco companies are fueling the tobacco epidemic, and that these companies continue to boldly market their products and aggressively fight efforts to protect health. So I want to move on and focus on the rest of the presentation, where I'm going to tell you about what tobacco companies have done to modify cigarette packaging to undermine public health efforts to make the pack less appealing and less misleading. So first, I'm going to discuss the issue of addressing the fraud of light and low tar cigarettes. Second, I'll discuss removing flavors that make cigarettes attractive, including menthol. And then I'll talk about the challenges in putting effective health warnings on packs. Okay, so let's start with efforts to address the fraud of light and low tar cigarettes. This is a picture of the second Surgeon General's report on smoking and health. It was published in 1967, and the report indicated that there seemed to be a dose-response relationship between the likelihood of getting a serious disease and the level of tar in cigarette smoke. So in other words, the report suggested that the higher the level of tar, the greater the risk of the cigarette. And there we go. And based on this, smokers were given advice. They were said, if you can't quit, you should try and choose a cigarette with less tar and nicotine. And boy, did the tobacco companies jump on this. They started to produce a whole array of light and low tar cigarettes, and they advertise these cigarettes to allay smokers' fears. So here is one of the ads for the True brand, and the ad copy says, "Considering all I'd heard, I decided to either quit or smoke True. And I smoke True." And this is how many smokers thought. They said, well, I'll just switch to a safer cigarette, a low-tar cigarette, and that will take care of all the potential negative health impacts down the line. There we go. So what does make a light cigarette light? Well, the way that tar levels are measured in cigarettes are through a smoking machine like the one pictured here. And the smoking machine takes a certain number of puffs at a certain frequency and a certain volume, and the smoke is collected on a filter, and then the levels of tar are analyzed. So what tobacco companies did to create their so-called light cigarettes is they put teeny tiny ventilation holes in the filters of the cigarettes. So when the smoking machine inhaled, air came in, diluted the smoke, and it resulted in lower tar readings on the smoking machine. Now, the problem is that humans are not machines, and the human brain knows when it's not getting the nicotine that it's looking for. So what smokers would do when they inhaled is they'd either cover the holes with their fingers or with their lips, or they would take more puffs and more frequent puffs and deeper puffs to try to extract more nicotine from the cigarette. So it took about a decade for public health to figure out the fraud of light and low tar cigarettes. And when we did, countries started to ban or prohibit the use of light and low tar descriptors on cigarette packs. So when countries did this, what did the tobacco companies do? Well, they complied with the letter of the law, and they removed the specific words, like light, that they were told they needed to remove. But instead, they started using colors, numbers, and new words to communicate relative strength and to try to communicate which cigarettes might be safer for those smokers who are looking for a safer cigarette. So we went from having Marlboro Lights to a very similar pack, looks exactly the same except without the word lights on it. And sometimes they even added the word gold to the pack. So smokers went from smoking Marlboro Lights to smoking Marlboro Golds. Now here's another example from the Pall Mall brand. The blue middle pack has lights written on it. And then after the ban on descriptors, lights became the word blue. And plus you had the color blue of the package. So red is usually for regular full-strength cigarettes. Blue is for light, green tends to be for menthol, and then like silver's for ultra-low tar and that sort of thing. All right, so this is the context of tobacco. So in this context of tobacco companies undermining public health efforts to try to address the fraud of light cigarettes, I was interested in this question. What do users of light cigarettes smoke when light cigarettes are technically no longer on the market? So that is when misleading descriptors like light and low tar are no longer allowed on cigarette packs. So we studied this in Canada because Canada was one of the first countries to ban light and low tar cigarettes. And actually it wasn't through new legislation. There was a voluntary agreement between the major tobacco companies and the Competition Bureau of Canada. The agreement allowed for a one-year transition phase from January to December 2007, after which no cigarette pack could have one of these misleading terms. And as an aside, these misleading descriptors like low tar were banned in the US in June 2010. Okay, so we used a longitudinal cohort study of smokers that surveyed the same smokers over time. And as part of the survey, respondents were asked what brand of cigarettes they smoked. The respondents were surveyed every 6 months, and that was between 2006 and 2008. So we had data on what brands they were smoking both before and after the ban went into effect. And then based on the brand that they smoked, we categorized smokers into one of 3 brand type categories. And they were regular cigarettes, lights, and what we called light replacements. And light replacements were brands that were meant to continue to convey a light cigarette, but just not using the word light or low tar. So for example, the new Marlboro Golds would be considered a light replacement. So let's look at how brand type changed over time. So this figure shows the prevalence of brand type over time from 2006 to 2008, with surveys occurring every 6 months. So baseline was in 2006, every 6 months until the end of 2008. And the red bar represents people who said that they smoked a regular cigarette, a blue bar, those who smoked a light cigarette, and the gold bar is those who smoked a light replacement cigarette. And you can see that the light replacements started to come onto the market during the transition period in 2007 and then continued to increase over time. And there was a concomitant decrease in those reporting using light cigarettes. So we found that even after light cigarettes were banned from the market, we still had 3 in 10 smokers reporting that they smoked, they would say, I smoke Marlboro Light. And I think that's because the companies did such a good job in both their marketing of, that it's the same pack, it just doesn't have light in it. They did such a good job with that marketing and the transition. And it's important to note that those cigarettes still had the ventilation holes, so they smoked the same way as their old light cigarettes. And then we had, 3 in 10 smokers reporting using light replacement cigarettes, so the Marlboro Gold. So they had numbers have switched over. So in the paper that we published on this study, we concluded that removing light descriptors from cigarette packs is likely not sufficient to prevent the use of the package to communicate relative strength and implied health benefits. So in other words, the public health effort to try to address the fraud of light and low tar cigarettes did not end up working very well because tobacco companies figured out new ways to communicate the relative strength of the cigarette. And so this is the last video I'll show you, just a quick video on this topic that was produced by New York City, where they're trying to tell the public that all cigarettes are harmful no matter what color they come in, whether it's, the blue lights, so-called, what people would think of as lights. So this is a quick one. Let's see.
Tobacco companies are now using colored packaging because deceptive labels like light and low tar have been banned. Don't be fooled. All cigarettes contain the same poisons that make you sick and kill you. Quit smoking today. For help, call 311.
Right. Okay. So trying to get the word out that they're not all the same, but I don't know, hopefully people call the quit line. So I want to move on now to the second topic, which is efforts to remove the attractive flavors from cigarettes, including menthol. Now, in 2009, the Food and Drug Administration banned cigarettes containing so-called characterizing flavors, based on research that showed that flavors were particularly attractive to youth. So here's the relevant language from the Family Smoking and Prevention and Tobacco Control Act. So it says, a cigarette or any of its component parts shall not contain a flavor other than tobacco or menthol, or an herb or spice, including strawberry, grape, orange, clove, cinnamon, pineapple, vanilla, coconut, licorice, cocoa, chocolate, cherry, or coffee, that is a characterizing flavor of the tobacco product or the tobacco smoke. Now, I'll just point out that characterizing flavor is not defined in the law, so we'll see how that plays out. But from what we can tell, it seems like tobacco companies have removed their flavored cigarettes from the market. But based on past experience, we expect that tobacco companies will tend to push the boundaries. And they can test and learn from marketing strategies that they use in countries with lower levels of regulation. So we were wondering if tobacco companies are experimenting in other countries with how to circumvent bans on characterizing flavors. So we wanted to examine the extent to which flavor marketing on cigarette packs is occurring in low and middle income countries. And we wanted to document any innovative ways that tobacco companies are communicating about flavors that are not strictly covered by bans on characterizing flavors. So to do this, we used a terrific resource that we've developed as part of a project led by my colleague, Dr. Kate Smith. We call it the Tobacco Pack Surveillance System, or TPACS for short. And this is a screenshot of the current website where you can search for packs by country or by brand. And for this project, we used a systematic protocol to purchase cigarettes and Kretex, which are clove cigarettes, in 14 low and middle income countries. And here they are: Bangladesh, Brazil, China, Egypt, India, Indonesia, Mexico, Pakistan, Philippines, Russia, Thailand, Turkey, Ukraine, and Vietnam. And in each country, we aimed to purchase one of every unique pack we could find. And we did that by going to 3 cities in each country and a sample of 12 neighborhoods in each city that covered a range of low, middle, and high socioeconomic status. So we were really aiming for a breadth of our sample. We had 2 coders, some are here, 2 coders that assessed packs for words and or imagery on the pack that denoted a flavor or a taste. So what did we find? Well, we purchased over 3,000 packs, 234 were Kretex, and the vast majority of these actually indicated clove flavoring. We had almost 3,000 cigarette packs that we coded, and 20% of these had at least one flavor-related word, and 2% had at least one flavor-related image. So let me show you some pictures. 8% of our packs had a menthol flavor stated on the pack. 1% indicated a mint flavor, not exactly menthol. And then we saw some packs that used words to suggest a menthol-like flavor. So here it's Ice Boost. So no mention of menthol, but you might think that it would give you the same sort of feel. We found packs indicating a fruit or citrus flavor. A few packs indicated an alcoholic beverage flavor. Some packs indicated that the user could change the flavor themselves, such as this click-on pack, or sometimes they're called crush cigarettes. So basically there's a menthol capsule in the filter that the user just presses, and then they can get their cigarette turns into a menthol cigarettes. We saw some packs that had images or words that suggested a flavor or taste, but maybe not a characterizing flavor. And then we saw some perplexing flavors, and it's not clear what they mean. So for example, we saw, it's hard to read, but it says flavor zone, M/4 or MX4 flavor, core flavor, and a few more examples of words that are not normally considered a flavor that are paired with the word flavor. So here's flavor mix, flavor of unity, and flavor code. So I want to point out that many of the packs that I just showed you are actually of the Marlboro brand, and my feeling is that Philip Morris International knows what they're doing. And I wouldn't be surprised if tobacco companies soon start introducing some of these unconventional flavors in countries that currently have bans on characterizing flavors. So we shall see. So what about menthol flavors? The FDA has been considering a ban on menthol cigarettes for a few years now. Now, menthol masks some of the harsh properties of cigarette smoke, so it allows a person to inhale more deeply and enhances nicotine absorption. And it also has some anesthetic properties, so it sort of numbs the throat and makes smoking easier. So here in the United States, young people smoke menthol cigarettes more than older people, and 83% of African Americans smoke menthol cigarettes. And that's why there's a big push to ban menthol. So the Canadian provinces of Alberta and Nova Scotia have already implemented bans on menthol cigarettes. It happened just last year. And Alberta tried to be a little more encompassing in their legislation. So they talk about a flavored product. A characterizing flavor has a clearly noticeable smell or taste other than tobacco. But they also cover themselves by saying, or it has a package or is labeled to indicate a flavor. So probably things that like flavor zone would probably be included because that has to do with the packaging, maybe not the cigarette itself. So one of the important questions is, how do tobacco companies respond when menthol flavors are banned? So we modified the TPACS protocol that we use for our global research, and we went to 2 cities within each of the provinces and visited vendors in 12 different neighborhoods. and some of our data collectors are here. So we went to Nova Scotia after their ban on menthol was implemented, and we were in Alberta a little bit before the ban came into effect and a little bit after it was implemented. So you'll likely see a pattern in these findings than when we think back to the findings around light cigarettes. So we found that once again, tobacco companies are adhering to the letter of the law. So in Nova Scotia, we didn't find any menthol brands. It's a very small province, and they were the first ones to ban menthol. In Alberta, before their menthol ban, we had 16 brand families that had menthol packs. And after the ban, only 4 brand families had what we called menthol replacement packs. And these menthol replacement packs, what happened was the descriptor changed. So before the ban it said menthol, and after the ban it said green. All right. So this is some business-to-business marketing materials that Philip Morris International had given to stores to help them sort of make that transition from menthol to green cigarettes. And one of the vendors showed our data collectors these materials. So it shows that, you know, what used to be menthol is now green. So just a little switch, not much else is changing, just that little word. And these menthol replacement packs, so they had this extra cellophane, and I have copies, examples here so you can come look at them. So there was extra cellophane that said new, smooth taste, redesigned without menthol. Here we go. So we've sent some of our menthol replacement packs to the CDC labs, and we're really looking forward to having them analyze the contents of the cigarettes to sort of find out what is in there. Is it a menthol analog? Is it something else that mimics the properties of menthol? Okay, so the last topic I want to cover is how tobacco companies undermine public health efforts to put effective health warning labels on cigarette packs. Now, here are just a few of the beautiful packs that we've bought in various countries. Some of them are here as well. The pack is clearly a marketing device, and it communicates aspirational brand imagery. So I'm going to show you a one-slide summary of the history of health warning labels. This is how all cigarette packs sort of looked before 1994. And in 1994, Canada was the first country to require a strong text warning on both the front and back of the pack. And then in 2000, Canada was again the first country to put picture warnings on the front and back of packs. And now countries continue to expand the size of the warning. So this is a pack from Uruguay, and they require picture warning covering 80% of the front and back of the pack. And just so you know, this is our current warning in the United States, a very small warning on the side of the pack. And so far, Australia is the country that has gone the furthest. So Australia implemented what we call plain packaging at the end of 2012, and I have a plain pack from Australia here. So this is what Marlboro Reds look like here in the United States, and this is what Marlboro Reds look like in Australia. This is the front, this is the back, and we've got an extra prominent warning on the side of the pack. The brand name is written in a standard font on a green-brown background. So all brands look the same, it's just Marlboro Red that would change. So this type of plain packaging helps remove the marketing potential of the pack and begins to convey that this is truly a harmful product. Now, plain packaging is important, but we also have to think about standardized packaging. That is packaging that is the same size, shape, has the same opening style, and with cigarettes that are the same size and look. So let me show you a few examples of the challenges of putting health warning labels on cigarette packs that are not standardized. So first there's pack shape. Here we see a pack of a traditional width, and you can pretty much make out the photo part of the warning. This is a patient on a ventilator. And this is what we call a lipstick pack. I have one of these here. So they're, less than half the width of a traditional pack. And the picture warning is really squished, so it's really hard to make out what's in the picture. Again, here's a traditional pack shape, and this is an extra wide pack. So again, the picture gets distorted when it has to fit a non-standardized pack. Rounded and beveled edges are also a problem. So here's another lipstick pack. It has beveled edges, and the warning, you can see the colors of the pack show through from the beveled edges, so it doesn't completely cover them. Here's a pack from Brazil that has rounded edges. So when you look at the health warning, which takes 100% of the back of the pack in Brazil, you still see color from the pack coming through. Opening styles are also problematic. Fancier opening styles provide more surface area for tobacco brand colors and marketing. So there's a pack with a butterfly type opening. This has a sort of cigar box type opening, and this is like a split pack opening. And this camel pack also has a butterfly type opening, and you can see all the extra marketing space that it creates for the tobacco companies. Now, you can't just standardize the pack, you have to think about the cigarette stick as well. So these next photos are from a poster that my colleague Kate Smith presented at a conference just a couple of weeks ago, and it shows the colors and branding on a range of cigarette sticks. So the tobacco companies are certainly also using the sticks. And here are a couple of additional examples where you can see the design of the pack follow through onto the cigarette stick. And tobacco companies are also playing with the filter tips, trying to make them novel and attractive. So both plain and standardized packaging are needed to address the attractiveness and marketing potential of the cigarette pack, and to better implement our health warning labels that are really important to communicate health effects to smokers. So we have to think about a standard size, shape, opening style, and then plain cigarette sticks that are of the same size as well. So in summary, these examples of addressing the fraud of light and low tar cigarettes, of removing attractive flavors from cigarettes, and of putting effective health warning labels on our packs all sort of show that we're often 2 steps behind tobacco companies. But I don't want to leave you with the sense that tobacco control efforts are ineffective, because that is definitely not the case. Indeed, tobacco control is held up as an example of a public health area that has made a lot of progress quickly. So what I do want to convey is that it is important in our public health efforts that we are always vigilant regarding the disease vector. And secondly, that we continue to learn from what's happening in other countries so that we can write better legislation, for example, that gives fewer loopholes for tobacco companies to exploit. All right, so where do we go from here? Well, Jeffrey Rose is one of my public health heroes. He wrote The Strategy of Preventive Medicine, and one of the things he said is that measures to improve public health, relating as they do to such obvious and mundane matters, such as housing, smoking, and food, may lack the glamour of high technology medicine, but what they lack in excitement, they gain in their potential impact on health, precisely because they deal with the major causes of common diseases and disabilities. Inequalities in health reflect the way that societies are organized. We already know what's desirable, the obstacles to its achievements, which prevent the majority from having what some already enjoy, are substantially economic, industrial, and political. Okay, so we cannot sit back. We have to act, and being neutral helps the oppressor and never the victim. Now, tobacco companies, as I said, their products subject us to almost 6 million deaths each and every year. Each of these deaths are completely preventable, and the epidemic is man-made, and we allow it to be sustained. So we need some bold new ideas to dramatically reduce tobacco use. One idea is to create a public health solutions lab, and it would involve going to the people. It would be solution-oriented and multidisciplinary. There would be a strong sense of urgency, building on all that we know and aiming to develop new, radical, but realistic high-impact solutions. And the activities of this Public Health Solutions Lab would include expert panel meetings, town hall meetings, demonstration projects, evaluation of those projects, scaling up those that work, more evaluation, and then learning through knowledge translation and exchange. So we need to start now so we can bring an end to the tobacco epidemic. And I just want to end with some acknowledgements. First, I have some of the mentors who really helped me at the earlier stages of my career. I want to acknowledge the collaborators for the work that I presented today, particularly Kate Smith and the TPACS project and the staff on TPACS. And then other colleagues, Dina Borzakowski worked on the B. Marlboro videos and has done other videos with us. Rob Schwartz and Dee Kittner have helped with the menthol project, and then my former doctoral students, Betsy Donaldson and Michael Chayton, also worked on some of this. I also want to take the opportunity to thank Dean Clegg and my chair, Dr. Holgrave, for their continued support, which is much appreciated. And the funders for the work that I presented, Bloomberg Philanthropies, the Lippitt's Public Health Policy Faculty Award, and the Ontario Ministry of Health and Long-Term Care funded the longitudinal cohort of smokers in Ontario. And then last but not least, I do want to thank all the terrific faculty, staff, and students at the Institute for Global Tobacco Control. So thank you.
Joanna, that was great. What do we know about, is menthol effective in either facilitating people starting smoking, or conversely, when you ban menthol cigarettes, do you see any decrease in prevalence of smoking?
Yeah, so good question. So there's clearly a correlation, and as we see, a lot of kids smoke menthol and then switch to other types of brands later. So the feeling, that's why there's a big push to ban menthol. So there's a correlation. The question is it causation? And if you ban menthol, are you going to have fewer kids starting? Or are they going to start with something else? So we don't know that. So in this menthol project that we started to do in Canada, we've looked at what, because those bans just recently went into effect, just in the end of 2015. So we're looking to see what tobacco companies are doing, but the next thing is to start looking at smokers and finding out what they're doing to try to sort of figure out what actually happens in real life when you get rid of menthol. Are you going to have the impact that you hope for, or is something else going to happen?
And I'll just ask another question before I open it up. So every year you fill this auditorium with people from all over the world that you teach advocacy about smoking, smoking cessation, journalists and policy folks. And what? And those efforts are funded through Bloomberg Philanthropies. How effective has that been, sort of advocacy building, as you look at the countries that you work in?
Yeah, so I'll just acknowledge Ben Lazari, who is the star of our Global Tobacco Control Leadership Program, and Steve Tamplin as well, who plays just a huge role. So we have seen tremendous progress over the 10 years of the Bloomberg Initiative to reduce tobacco use. So I think, we've had, I think, 1,000 alumni of our capacity building programs over this period, and it's amazing to see, many of them are still working in tobacco control, and things are happening in countries that you would have never expected. So for example, Russia has gone 100% smoke-free. They have a total tobacco display ban, which means stores can still sell cigarettes, but you can't see them when you walk into the stores. So they're either under the counter or behind a closed shelving. They've banned cigarette sales from kiosks, so anyone who had been in Moscow and walked down the street and saw kiosks filled with cigarette packs, that's completely gone. So Russia, has taken huge steps. We're sort of on the verge of China going 100% smoke-free. Sort of that might finally be happening, and I think it is really that. The Bloomberg Initiative has had a huge hand in that and really supporting that work, and hopefully we've had can take a little bit of credit as well.
Great, thank you. So, so Peggy, use the mic because this is being video recorded. Nobody will hear your question unless you.
Great talk, Joanna. So I know when you first got here, you had done a lot of work on tax policy, but you don't mention that today. Is that because you've lost interest? It doesn't, what is it with tax policy and cigarettes?
Yeah, so tax policy is really important, and in tobacco control, we say it's our single most effective lever for reducing smoking, just because of regular economics, supply and demand, and people are going to smoke less if cigarettes cost more. I didn't talk about it today just because I was trying to talk about mosquitoes and the vector of disease. And I mean, tobacco companies still work very hard to lobby against tobacco taxes. It's a particularly difficult intervention to implement because it's not really the purview of a Ministry of Health, or it's the purview of a Ministry of Finance. And it's very hard for health, they're working with dollars and cents and not really the health arguments, and the fact that it ends up being a win-win situation. It's really hard to get through. So there's been a lot of work on tobacco taxes, let's say in the Bloomberg initiative, for example, but that's the area where the least amount of hard progress has been made.
So other questions or comments? Oh, okay, so Anna, and then Josh, there's a mic over there if you want to get to the...
Thank you so much, Joanna, for the talk. I wanted to ask you, you showed that figure with the numbers, the millions of smokers around the world from the late 19th century to today. And there seems that we can see some hope that increase is kind of plateauing a little bit. Do you think, when are we going to see it coming down? Do you think we'll see it? Is it something that we can, maybe in 10 years, 20 years? Can we expect it to happen in our research, in our academic careers?
I certainly hope so. I think, so as I showed, thanks for the question, Anna. As I showed, China is really driving these numbers. So, the top cigarette consuming country by far in the world. So if we're really going to change the numbers, we have to do something in China. And I think, I already said that it seems like the conditions are ripe finally, that something's going to happen. And just like in Russia, we expect that in China, if the government makes a decision to do something, it will be implemented and there'll be compliance and it will be followed. Beijing last year implemented 100% smoke-free rule for restaurants, bars, and other indoor places. So, and the compliance seems to be very good in Beijing now. Shanghai is on the verge of doing that. There's a lot of work to do that in a number of other cities and provinces, but hopefully we're going to see some action at the country level, and that will start to bring down smoking rates in China. I think as part of that smoke-free law currently, they're hoping to also include restrictions on advertising and promotion of tobacco products, as well as health warning labels. So some of my most beautiful packs are from China, and they've got to address that, but we'll see if that withstands the hard fight ahead.
Great. I thought it was terrific, really interesting talk. One of my very first projects as a fellow was being a staff researcher on the Zeltner report. So it's great to see you quote that too. Part of that report, my chapter was on how the tobacco industry infiltrated the pesticide regulation effort at WHO, and they actually secretly paid for a consultant to WHO to regulate tobacco pesticides in sort of the way the tobacco industry wanted. And I tracked him down, he had retired, and I interviewed him, and he said, "This is a total outrage." And I said, "What?" And he said, "The outrage is that the documents are out identifying me as a tobacco consultant. They promised that they would keep it secret." So, going off your vector analogy, if you were to make a more complicated diagram where you would show how the vector infiltrates others to be successful, it's not, that there are intermediate steps. What do you think the most important ones are if you look at a country, what the tobacco industry, the United States, we have a history of cultural institutions taking a lot of money, protecting, you know, there's a whole set. And as you look globally, who do you think the unwitting or sort of witting or, you know, accomplices are to that vector?
Yeah, what a tough question. And I think, you know, in that Zeltner report, so by the way, that's the report with the quote, "Mosquitoes have no lobbyists." So even in that report, there was a whole range of strategies identified, trying to defame individuals, working through third parties on other issues, trying to challenge the authority and the reputation of the World Health Organization. I mean, they just went at it from all different directions. And I don't know, I think, so philanthropy is certainly key. So what tobacco companies have done in this country and in others is give a lot of money to Boy Scouts, sporting events, churches, all kinds of groups in society to help them out and quiet them up. And African American groups, I mean, there's a whole lot of literature on that, even in the US. And I think that partly feeds into the sense of just not making this a priority, that there are other issues. Maybe this isn't so urgent. I mean, there's really direct lobbying going on in some of the countries that we're working in and some of the low and middle income countries. And even, you know, some of our tobacco control colleagues have had threats put out on their lives and their families' lives, so really trying to shut people up sort of personally. And I know when I started in tobacco control here, actually in North Carolina in the early 90s, at that point, people were still pretty paranoid about tobacco companies coming after them. In those days, there wasn't as huge a tobacco control community as there is now, so it's easier to sort of identify the people. And there was a bit of nervousness in those days as well about being singled out. So I don't know, I think there's a whole range of strategies that are used, but do you have, I mean, anything to add to that, Josh?
I would just say that I think that it's the right model, you know, to think about it. It's very different than other challenges. And that there may be these intermediate steps where you can, and you know, it used to be universities did a lot of research in the United States, and schools of public health teamed up with the tobacco industry, and then, you know, and others. And I think that it delegitimized the tobacco industry for universities to say we're not going to take tobacco industry money, and that's sort of a way of dealing with the disease vector, you know. And in terms of thinking about how you intervene, you kind of have to isolate it a bit. The more it becomes part of everything. But I don't know the international side and how they work in civil society, as I say, to make that happen.
I mean, a lot of things are pretty similar all over the world. So, and I have to take this opportunity to say that Johns Hopkins Bloomberg School of Public Health was one of the first schools of public health to stop taking tobacco money and donations. And I remember in my early years, in my career, in Canada, we were trying to get through a ban on tobacco sponsorship of sporting and cultural events. And I was sitting there thinking, why are we pointing our fingers at all these other groups, tennis and race car drivers taking tobacco money, when the university, like, we have to look at the dirt in our own house as well, and the university taking money. And I actually wrote a paper called Institutional Addiction to Tobacco to try and lay out the relationships between universities and tobacco companies. Yeah.
Well, oh, Ian, good to see you. There you go. You're very quiet.
It was a scripting. So about 6 years ago, I'm not exactly sure the exact year, Bill Gates talked to then Premier Wen Jiabao to do something about tobacco in China. And he was very, very resistant. But then when Bill said you can do one thing, because I think he was fed with all the economic arguments, you could raise the tax. And I said, oh, you can do that? And several months later, the tax was actually raised. But then you know what happened? Mm-hmm. The tobacco industry absorbed the tax rather than pass the cost to the consumers.
So they reduced the price.
Yeah. Because they had so much profit that they could afford, you know, to do that. So listening to you now saying that China is on the verge of something radical, is really good news. But I was in China only a few days ago. I just returned the other night. And in the hotel that we were staying, this was an international meeting. It was strange that all of us were complaining about the same thing. We were on the floor which was non-smoking, and all of us were complaining that all the rooms wrecked with smoke. Okay. So that's just a comment on that.
There's definitely more work to do.
Just another one. Indonesia, which has not ratified the treaty, a person who was very closely associated with Hopkins, was the chair of the Muhammadiyah, that's the most prominent religious group there. They issued a fatwa against smoking. And as a result of that, the tobacco industry dug up a lot of things about him, including a visit to Israel many years ago. And then stories came out in the papers that this fatwa was actually influenced by the Bloomberg School of Public Health, of which was funded by a Jew whose name is Michael Bloomberg, trying to influence Indonesian Muslim organizations. So it's amazing, how the tobacco industry could just turn around, these kinds of things. Your comments?
Well, yeah. It is challenging, and I think there are a lot of ethical issues that are raised in what priorities, what gets addressed, and what, the role of these funders in setting the priorities. Obviously, we're doing great. It's important work to be done, but this work is challenging. I think it does, because we've talked about that a political solution is needed, for these core public health issues. You can't just treat it, you can't just cure disease, but you have to address sort of the underlying economic and political issues. And to do that, you're going to have to work with policy-making bodies to change the structure of society. So it's a challenge.
But I mean, you work across all levels of civil society, right? The tobacco industry is a potent enemy. Lots of money, lots of influence. But it's either the number one or the number two cause of death around the world. And as public health, as we expand our mission to do chronic disease, we have to be strong in tobacco control. And we're very fortunate to have you here doing tobacco control and leading us. So thank you, Joanna. Please join me in thanking her for a great talk and for all her work.